day everyone. In this video, I will be explaining on how to follow health protocols during this pandemic. So first, nowadays, it is very hard to go outside during this pandemic. So there are different health protocols on how to lessen the spreading of COVID-19. First protocol is maintaining space between yourself and others is a best practice and is one of the best tools to avoid the exposure in COVID-19. People can spread the virus without being sick or knowing they are sick. So it is important to maintain social distance from others whenever possible. It can also reduce the spreading of COVID-19 virus. If you go to the crowded places, stay at least 2 meters from others. Everyone should follow these physical distancing practices. First, if you go to the crowded places, please stay at least 2 meters from others. Meeting should take place online instead of conference room. Arrange the chairs in common areas to maintain the physical distancing. Stay out of crowded places and avoid mass gathering. Handshaking and other forms of physical contact are discouraged. Face coverings. The use of face coverings, including homemade masks, scarves, bandanas, or handkerchief, and disposable face masks helps to minimize risk to the wearer and to those around them. It is the responsibility of each individual to comply with this protocol. Face coverings must cover the nose and mouth. Wearing face mask is required, especially if you are going to the crowded places like malls, markets, and other places that are so many people go there. Wearing a face shield is also important part of our protocol. It is also possible that virus can enter your eyes by rubbing using your hand. Proper hygiene. It is important to maintain the cleanliness of your body, especially the hand washing. Hand washing is one of the most important action individuals can take place in preventing the spread of COVID-19 virus. Hand washing should occur after touching anything in a public area, after using the restroom, prior to eating, and after touching one's face or blowing one's nose. This is coughing and sneezing hygiene. Always remember to cover your mouth and nose with a tissue when you cough or sneeze. If you do not have tissues, cough or sneeze into the inside of your elbow, not into your hands. Throw tissue in the trash and immediately wash your hands with soap and water or use hand sanitizer that contains at least 60% alcohol. Clean and disinfect is one of the protocols. Clean high-touch surfaces daily. These include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If someone is sick or has tested positive COVID-19, disinfect frequently touched surfaces. Use a household disinfectant product. If surfaces are dirty, clean them using detergent or soap and water prior to disinfection. Last protocol is monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature. If we follow all of this protocol, we can control and reduce the spreading of COVID-19 virus. Thank you for watching this video. I hope you learned something. Bye!